Death is a natural part of life, but it's the part we all have a hard time accepting. As caregivers, we often find ourselves in the position of helping others deal with death. For this reason, it's important to have a good understanding of the processes of dying and grieving. The stages of dying. Death can occur suddenly and without warning, or it can be expected. Older people or people with terminal illnesses may have the opportunity to prepare for death. Preparing for death is a process that involves the dying person's emotions and behavior. In 1970, Dr. Elizabeth Kubler-Ross, a psychiatrist and world-renowned authority on death, published a book entitled On Death and Dying. In it, she describes 5 stages that dying people and their loved ones commonly experience before death. Not all people will go through all the stages. Some may stay in one stage until death occurs. Some may move back and forth between stages during the process. The 5 stages of dying. Denial. People in the denial stage may refuse to believe that they're dying. They often believe a mistake has been made. They may talk about the future and avoid any discussion about their illness. This stage may last a few hours, days, or longer. Some people are still in the denial stage at the time of death. This is the "no, not me" stage. Anger. Once they start to face the possibility of their death, people with terminal illness become angry that they're the ones dying. They may be angry because they believe they're too young, or because they've always been good or taken care of themselves. They're still not ready to accept the idea of their death. Anger is a normal and healthy reaction. As a caregiver, you must learn not to take the anger personally. This is often called the "why me" stage. Bargaining. Once people have begun to believe that they really are dying, they may make promises to God or somehow try to bargain for their recovery. They may promise to do something special or change their lives if they're allowed to recover or live longer. This is the "yes, me, but" stage. Depression. As they become physically weaker, the symptoms of the progressing illness become more pronounced. People who are dying may become deeply sad or depressed. They mourn for their lives, and they may talk about all the things they're leaving behind. They may cry or withdraw into silence, or be unable to perform even simple activities. They need physical and emotional support from skilled healthcare providers and family members. At this stage, they need to review their lives and their feelings. It's important for you to listen and be understanding with clients in this stage of death. Acceptance. Some people who are dying are eventually able to accept death and prepare for it. They may make plans for their last days or for the ceremonies that may follow. At this stage, people who are dying may seem emotionally detached. The grief process. Grief is a feeling that may begin before the death of a loved one as well as after. People may have several feelings at once, or they may pass through different stages of grief at different times. Just as with dying, grieving is an individual process, and no 2 people will grieve in exactly the same way. Clergy, counselors, or social workers can provide help for those who are grieving. Family members or friends may have any of the following 7 reactions to the death of a loved one. The 7 stages of grief. Shock. Even when a client has lived a long time with a terminal illness and death was expected, family members and friends may still be shocked after death occurs. Many of us do not know what to expect after the death of a relative or friend and may be surprised by our feelings, even when we knew death was coming. Denial. Sometimes we want to believe that everything will quickly return to normal after a death. We want to believe that we don't have many feelings to cope with. Denying or refusing to believe we're grieving can help people deal with the hours or days after a death. But eventually we must face our feelings. Grief can be so overwhelming for some that they may take years to face their feelings. Professional help can be very valuable. Anger. Although it's hard to admit it, many of us feel angry after a death. We may be angry with ourselves, at God, at the doctors, or even at the person who died. There's nothing wrong with feeling anger as a part of grief. Guilt. It's very common for families, friends, and even caregivers to feel guilty after a death. We may wish we had done more for the dying person, or we may simply feel that he or she didn't deserve to die. We may feel guilty that we're still living. Regret. Often we have regrets about what we did or didn't do for the dying person. We may regret things we said or didn't say to a person who has died. Many people carry regrets with them for years. Sadness. Feeling depressed or down is very common after a death. We may cry or feel emotionally unstable, and we may suffer headaches or insomnia when we can't express our sadness. Loneliness. Missing someone who has died is very normal and can bring up other feelings such as sadness or regret. Many things can remind us of the person who died, and the memories may be painful at first. With time, we usually feel less lonely, and memories are more positive and less painful. Feelings and attitudes about death differ among people. Death is a very sensitive topic, and many people find it hard to discuss. Some people cope with death more easily than others. Our feelings and attitudes about death can be influenced by many factors, such as our experience with death, our personality type, our religious beliefs, and our cultural background. We can recognize and report common signs of approaching death. As I said before, death can be sudden or gradual. However, there are certain physical changes that can be recognized as signs and symptoms of approaching death. These changes are blurred vision that gradually fails, unfocused eyes that seem to stare without seeing anything, impaired speech, diminished sense of touch, loss of movement, muscle tone, and feeling, beginning in the feet and spreading upward, rising body temperature or below normal temperature, decreasing blood pressure, a weak pulse that is abnormally slow or rapid, slow irregular respirations or rapid shallow respirations, cold pale skin, mottling, spotting, or blotching of skin caused by poor circulation, perspiration, incontinence, and disorientation or confusion. There are some simple guidelines to follow when caring for a dying client. The senses diminish in a dying person. As vision fails in clients who are dying, they naturally turn toward the light, and they may fear the dark. Keep the room softly lighted and without glare. Because they cannot see well, but may still be able to hear, dying clients should be told about any procedures that are being done to them or what is happening in the room. Speaking may become difficult for the dying client, but hearing usually remains until death occurs. Therefore, talk to the client in a normal voice, but don't expect an answer. Ask few questions and only ones that require a simple yes or no answer. Encourage the family to speak to the client, but to avoid subjects that are disturbing. Try to anticipate the needs of the client by observing their body language. Care of the eyes, nose, and mouth is important. Mucus secretions in the eyes, nose, and mouth may collect and become uncomfortable. Mouth care should be given frequently. This care may be provided by a visiting nurse, a family member, or you may be taught to do it. As the client drinks less fluids and the mouth becomes dry, mouth care will have to be performed without assistance from the client. The skin around the eyes can be bathed with a normal saline solution. A lubricant may be applied lightly to the nose if irritation and crusting occur. Elimination patterns change. Bowel incontinence or constipation may occur. Enemas may be ordered for constipation, and medications and a special diet may be required in the event of diarrhea. Foley catheters, special tubes that are inserted into the bladder for urinary drainage, may be used for urinary incontinence or to help drain urine if urinary retention is a problem. Waterproof pads or disposable pads may be used under the client. Clients should be kept clean and dry for both health and dignity reasons. Skin care must be increased. Clients who are perspiring should be bathed often, and sheets and clothes should be changed for their comfort. Skin care to prevent pressure sores is very important, especially for clients who are immobile or incontinent. Comfort becomes a primary concern. Pain relief is very important, and clients may not be able to tell you that they're in pain. Observe your clients for signs of pain and report them. Clients can also be made comfortable with frequent changes of position, gentle back massage, good skin care, frequent mouth care, and proper body alignment. Because body temperature usually increases, many clients are more comfortable with light covers, even when the skin feels cool to the touch. The client may perspire more. The client's environment can greatly affect the client's dying experience. Keep the room neat and tidy. Display favorite objects, photographs, cards and flowers, religious items, and mementos in places where the client can easily see them. They'll provide comfort. Cover equipment that may be disturbing. Make sure the room is comfortable, appropriately lighted, and well ventilated. We've covered a lot about the physical things we can do for our dying clients, but I want to spend just a minute discussing emotional and spiritual support. We often feel uncomfortable talking with those who are seriously ill or dying. Because we're empathetic, we're naturally afraid of saying something that might be upsetting or inappropriate. What the dying need most, however, are not words. In the early stages of death, they may just need someone to listen to them as they reflect on their own lives, or discuss their fears and concerns about dying. For many, the greatest fear is of dying alone. For that reason, they may simply need the quiet, reassuring, loving presence of another person. Touch can be very important. Holding your client's hand as you sit quietly can be very comforting. And of course, your dying clients may also seek spiritual comfort from clergy members. Be sure to offer the client privacy when a family or clergy member comes to visit, and return to the client's side promptly when the visitor leaves. Lastly, I want to share some simple guidelines for post-mortem assistance. Post-mortem means after death. When a client dies, it's extremely important to be sensitive to the needs of the family. Family members or friends may wish to sit by the bed to say goodbye. Be aware of the religious practices that the family wants to observe. You should always follow your agency's policies and procedures, but additionally, it's important that you not move the body in any way or touch any equipment attached to it. If hospice was involved in the deceased's care, hospice must be notified of the death. They will come to the house and provide direction. While the family and medical personnel gather, offer to answer the phone, make coffee or a meal, supervise children, or keep the family members company. Do not leave the home until the client's body has been removed or until your supervisor says you may leave. You may go through your own grief process after a client's death. Be sure to take care of yourself and consider what phases you go through in dealing with that death. If you have difficulty dealing with a client's death, speak with your supervisor for guidance. This completes Chapter 9.